So what is your name?
My name is Betty.
Fatty. So what name do you prefer me to call you?
Just call me Betty.
Okay, Fatty. So may I know your date of birth?
July 7, 1998.
Okay, July 7, 1998. Let me check. Okay. So tonight I want to examine your ears. Is that okay with you?
Yeah.
Okay. So I will examine your ears, and it involves a lot of questioning and also hand gestures. So I will ask you to do something for me, and I want your cooperation during this assessment. Is that okay with you?
Yeah.
Okay. Okay, so Fatty, I will just wash my hands, perform hand hygiene, and wear my gloves, and then I'll be back. Okay? Okay, now I put on my gloves, and then I provide privacy of the patient. I close the door and I close the curtain. So, Fatty, before I proceed for the examination, I just want to ask some questions about your family history. Is there anyone in your family have hearing loss?
No.
Okay. So, how about you? Do you feel any pain in your ears?
No.
No. So how about your lifestyle? Do you use headphone often, or are you listening to music?
I'm just using headphones sometimes.
Sometimes. So do you take any medications?
No, not at all.
Okay. So what about listening to loud music?
No.
Okay. So now I will put it in a record. So I want to check your ears. Okay, it seems to me that it's symmetrical, and I just want to check your curl first. Okay, so I just want to pull it up, pull it down, and then backward. Okay, there's no abnormalities and no lesions. So I just want to check your mastoid. Do you feel any pain?
No.
Nothing at all? Okay, so I want to push your tragus here. Feel any pain or no? Not at all. Okay, great. So now what I'm going to do is to check your ears by using the otoscope. Okay? So I just want to check your eardrum. Assessment, I use a little bit bigger for adult, a little bit bigger of the headpiece, because my client is already an adult. We're using the otoscope, so I want to check your eardrum. So I want to pull your ears a little bit. Okay, so it seems to me that I didn't see any lesions, and your eardrum is fairly gray. Okay, so I'm gonna check the other side. Okay, there's no lesions, no abnormalities. Your eardrum is fairly gray. Excellent. So now we're gonna check your hearing, okay? So I want to perform a test, and I want you to perform it with me. So what I'm going to do is I will stay back. I will stay behind your back, 2 feet behind your back, and then I will say a 3-letter word, and then I will just whisper the 3-letter word, and then you will tell me if you can hear the word, okay?
Yeah.
Okay. So I will touch your shoulder and whisper the word and say what word I am whispering.
Check.
Okay, great. So I will move on the other side of your shoulder. Can you move a little bit in here? Okay.
Dog.
Okay, great, excellent. So now what I'm going to do is I'll be using a special technique. Here is the tuning fork. So it is only an imaginary tuning fork because I don't have available with me. So I'll be using this to test hearing and lateralization of my client. So I have here the tuning fork. What I'm going to do is I will tap it and then it will vibrate. What I'm going to do is to put it on the center of your head and tell me if you can hear the vibration, okay? Can you hear it?
Yeah.
Where can you hear it? In left both ears.
So,
Okay, great. So what I'm doing is the Weber test, where I put the tuning fork at the over the head of my client and check if she can hear the vibration. The Weber test is to test my client if she has a hearing loss and if it is a conductive or neural sensory. Fatty, I'll be using the Rennie test. This is a test to check for your hearing if it is air conduction or bone conduction. So what I'm going to do is to vibrate using this tuning fork again and put it at the back of your ears, the mastoid, and then you can tell me if you can no longer hear the sound. Okay, so I will keep it on vibrating. So I will vibrate.
yeah, I feel the vibration.
Can you hear the sound?
Yeah.
But tell me if you can no longer hear the sound, okay?
No, it's gone.
It's gone. Okay. So what I'm doing now is the Rennie test, and I will check. I will put it 1 centimeter near your eardrum, and then tell me if you can hear the vibration and when it stops. Okay?
It stopped.
Stop.
Yeah.
Okay, great. So I will do in the other side of your ears. So tell me if it stops, if you can no longer hear the sound.
And I can hear you.
Tell me if it stops.
It's gone.
It's gone. Okay. So now I will put near your eardrum, 1 centimeter away from your eardrum. Tell me if it stops.
Yeah, it's gone.
Okay. See, as far as my assessment, this is what I found out. Your auricles have no deformities, and they appear to be symmetric on both eyes. So when I check your mastoid, when I push the mastoid, when I check your mastoid here, so you don't feel any pain. And when I check your eardrum, I didn't see any exited or any drainage. And when I push your tragus, so you don't feel any pain at all. So during the assessment, when I use the otoscope, so I didn't see any drainage or exit, and your eardrum is fairly gray, and which is very excellent. Okay. So when I performed the test, your hearing test, when I whisper a word and you can hear it. So what does it mean? So it means that you don't have any problem with your hearing. So when I use the special technique, the Weber test, so when I vibrate, you can feel it, and you can feel it also when it stops, right? And when I use the Rena test using that tuning fork, so it vibrates behind your ears. You feel it also, and so it means to say that there is no problem at all. Okay, so overall you don't have any problem in your hearing. That's the end of my assessment. So is there any clarification that you want?
No, I'm good.
Okay, so no questions at all?
Yeah.
Okay, so I'll just remove my gloves, wash my hands, and sanitize. So that's the end of my assessment for the ears. So I will record and report.